Depression is, it's low mood, depression is. I mean, we all have days where we experience the blues, if you like, ebb and flow of life, and sometimes we feel sad. And that might actually be estimated as being like mild depression. But when we're talking about clinical depression, we're talking about where the signs and symptoms last for at least 2 weeks, interferes with your everyday life, so you probably have problems getting out of bed or going to work or just doing like normal daily chores. There are different types and levels of depression. Mild depression might not necessarily be treated with any form of medication, whereas severe depression might require, medication. In terms of the cause of depression, so it could be genetic, mainly traumatic life events, pressure of life. I mean, life itself is a stress, isn't it? And a strain. Things like trauma in terms of like grief, bereavement, a simple thing as moving home or getting married, having a baby, even environmental factors as well as social factors. All of these things can cause depression in someone who might be vulnerable to that. Depression is common among all ages. It might be particularly hard for younger people where stigma is concerned, for example. They may not want to admit that they're depressed because of names that they might be called. It's quite brutal sometimes, even in the playground, at schools and that kind of stuff. I mean, there are a lot of young people who are carers or have parents who are experiencing or struggling with mental health issues. They might themselves become depressed as a cause of that. In terms of the dangers of masking depression, again, stigma's out there, and stigma's a problem, and because of that, people might hide their depression, and that can compound the problem and make it more severe. Because we all need each other, we all need help, and people who are afraid of stigma, afraid of experiencing stigma, won't probably go to their GP, won't discuss it with their family, won't seek help externally and try to deal with it on their own, which is not a good strategy actually, and it can cause, as I say, lead some people to even take their own life. Men and women cope with depression in different ways. Women are more likely to talk about their depression. They're more likely to go and visit the GP. Men are more likely to self-medicate, isolate, and unfortunately, the suicide levels among men is quite high. In terms of society, what society can do, talking about it more, getting the message out there that depression is common, and both men and women will experience depression. We're human beings after all. Life is hard, stresses and strains of life are very hard, and we all will have times where we struggle, where we can't cope, and you're not weak because you experience depression. It's not because you're weak or there's something wrong with you or anything like that. It's just that's just life, and it's common. It's acceptable. It's not strange, and I think those are the messages we need to, as a society, we need to get out there. In terms of signs and symptoms of depression, people might, talk down about themselves, or they may be negative in their thinking, have a negative outlook in life and that kind of stuff, and probably even talk about things like, it's always them, and look on the dark side of life, things like that. In terms of behaviour, people might withdraw, become isolated. There are a number of things that you can do to help yourself if you're suffering or experiencing depression. One of the first things you do, visit the GP. You can also make sure you get a good night's sleep, a good healthy diet, go for walks, exercise. Sometimes just standing in the fresh air and taking a deep breath, feeling the breeze all over your body, that sort of stuff going into your lungs. Kind of takes the focus off yourself, gets you to focus on things around you. A good daily routine as well might help. Doing things routinely throughout the day could help you to feel a bit more control, and talking to people. Birmingham Mind has a 24-hour helpline. So you can call the helpline for advice, and they'll signpost you and help you to develop the resilience and the coping mechanisms you need to achieve your goal of recovery.